Good day! For today's video, I'm going to discuss about my parasite. It is called Giardia Lamblia. And once again, I am Giardia Lamblia. So this is our table of content that I will share with you. The first one is distribution, habitat, morphology, life cycle, source, pathogenesis and clinical features, diagnosis, treatment, symptoms, and prevention and control. So what is Giardia lamblia? Giardia infection is an intestinal infection marked by stomach cramps, bloating, nausea, and bouts of watery diarrhea. Giardia infection is caused by microscopic parasite that is found worldwide, especially in areas with poor sanitation and unsafe water. Okay, so let's talk about the distribution of Giardia lamblia. It is a worldwide found in the soil, water, or surfaces contaminated with the feces of infected human animal. So Giardia lamblia is found worldwide, especially in areas with poor sanitation and unsafe water sources. It can be transmitted through contaminated water and food. And next, let's talk about the habitat of the Giardia lamblia. It is prefers the duodenum and upper jejunum of humans because these areas offer suitable pH levels, ample surface area, and nutrient availability for the parasite to thrive and attach to the intestinal lining. The third one is morphology. It exists in two forms. The first one is cyst, the second one is tropozoid. Let's talk about the cyst. Cyst is a overcyst is thick-walled with the four nuclei and several internal fibers. Each cyst gives rise to two tropozoids during the existation in the intestinal tract. And the tropozoid is pear-shaped with two nuclei, four pairs of flagella, and a suction disc are present. And now let's talk about the life cycle of Giardia lamblia. Is typically transmitted through contaminated water or food or via the fecal oral route. In the small intestine, cysts release tropozoids, which multiply and can be free or attached to the intestinal lining. As they move toward the colon, they insist. Both cysts and tropozoids are found in feces, with cysts being more common in non-diarrhea feces due to their hardness. Tropozoids are typically found in diarrheal tools. Person-to-person transmission is possible, particularly when cysts are present in stool. And now the source of Giardia lamblia. Is the parasite responsible for giardiasis is primarily found in the feces or infected humans and animals. The main sources of Giardia transmission include contaminated water, food, person-to-person contact, animal contact, poor hygiene practices. And now let's talk about the pathogenesis and clinical features. Pathogenesis is Giardia lamblia infects various mammals, including humans who can act as reservoirs. Risk groups include hikers drinking, untreated stream water, male homosexual, children in daycare centers, and patients in mental hospitals. And the clinical features, giardiasis can cause weight loss and failure to absorb fat, lactose, vitamin A, and vitamin B12. And this is an example of clinical features: anorexia, flatulence, upset stomach, nausea, vomiting, stomach or abdominal cramps, watery or non-bloody, foul smelling diarrhea, and greasy stools that tend to float, and dehydration or loss of fluids. In children, severe giardiasis might delay physical and mental growth, slow development, and cause malnutrition. Okay, so diagnosis of Giardia lamblia typically involves stool examination, stool antigen test, polymerase chain reaction or PCR, and serologic test, and duodenal aspirate or biopsy. So diagnosis in Giardia lamblia is often confirmed by observing the characteristic pear-shaped trophozoites, or cysts in stool samples. So this is how to treat Giardia Lamblia. Metronidazole, tinidazole, nitazosanide, and paramomycin. And also, there are the symptoms of Giardia Lamblia. The first is watery diarrhea, fatty or greasy poop that floats, stomach pain and cramping, intestinal gas and bloating, nausea and loss of appetite, and increasing fatigue. And the last one, let's talk about the prevention and control. It is practicing personal hygiene, household hygiene, safe food practices, and safe water use. It is crucial for preventing the transmission of Giardia Lamblia and other infections of disease. And that will be all. Thank you and God bless.